Welcome to the show. I'm Kathy Ireland. Since it was first established in 1998 as the Chi Institute, Chi University has provided students with top-rated continuing education and graduate-level programs focused on traditional Chinese veterinary medicine, other integrated veterinary medicine modalities, including rehabilitation and spinal manipulation. Today, we're joined by the university's president and chief academic officer, Dr. Husheng She, to learn how the school's innovative programming, distance learning offerings, and on-site lab practices are meeting the ever-changing needs of the global veterinary community. Welcome, Dr. She.
Thank you, Kathy. I'm so happy to be here with you today.
Well, we're thrilled you're here. And Dr. She, can you tell us what is traditional Chinese veterinary medicine?
Traditional Chinese veterinary medicine was developed several thousand years ago, specifically for horses. Since then, gradually applied to other species, such as cattle, pig, dog, and cat. It's compatible with modern medicines. For example, we can use a painkiller, Lumidale, for pain management for the dog associated with arthritis. Now, we can use one of the modalities of Chinese medicine, acupuncture, simply able to block the pain, make the pain away. So as you can see, acupuncture slightly different from pharmaceutical medication. Number one, actually lateral stimulate the body, let the body release neurotransmitter, and then will block the pain will relieve by itself. So it's natural.
Right.
The second difference of Chinese medicine is holistic approach to the patient, which meaning treat the body as a whole. I will give one example. 10 years ago, I say 6 years old border collie, Misty. Misty has multiple chronic illness, has the liver problems, has a seizure, and also skin allergy. Even though with the 10 different medication, the dog still seizure, still itching, the liver inland getting higher and higher. Therefore, I was invited to evaluate this dog to say what Chinese medicine able to do. When I examine this dog, this typical case of one element problems, liver wound disorder, cause all those three conditions, liver problems, seizure problems, skin problems. So I balanced this wound dog with herbal acupuncture food therapy. When that root of disease was balanced, all those issues getting better. Not only liver enzyme become to normal, seizure is gone, skin was cured, and also we're able to gradually weaning off pharmaceutical medication. This dog lived another 9 more years with great quality of life before passed away at age of 15.
Wow.
As you can say, that's the Chinese medicine holistic approach. Treat underline what the root is. The body has so much great potential healing powers. They can heal by itself.
Oh, what a beautiful story about Misty. I love that.
Yes.
Wonderful.
Yeah.
And Dr. She, what are the top integrative veterinary modalities?
Well, medicine can be divided into 2 categories. One is conventional medicine, another is non-conventional medicine. Conventional medicine refers to medicine itself, surgery, emergency, that was taught in veterinary medical school. Non-conventional medicine refers to modality has been used thousands of years, but not taught in regular vet school yet. I always support integrated approach, meaning whatever the best option available for my patient, I will use it. For example, if I have the patient broken the bones, I immediately refer that case to the surgeon because surgery works the best. If another patient has acute onset bacterial pneumonia, antibiotics is my first choice. However, like the Misty has a multiple chronic illness, a combination of acupuncture, herbal, food therapy works the best and also tends to be safe.
well, congratulations to you. What did that transition from Chi as an institution to a university, what did that mean to your student population in terms of what you're able to offer?
Fabulous questions, Cassie. Conventional veterinarian challenge us. No evidence at all. There is acupuncture lesson. They just cannot do this because they never saw the paper published. So when I read that feedback or the challenge, I sat down, how able to answer those challenge questions. I do now, we don't have enough English published paper available in Western countries. How they able to answer those challenges? We have to have university, because if a university, we can have the graduate program conduct high quality research. So when the research conduct, they're able to publish funding on the peer review journal in West countries. So this conventional veterinarian able to read the paper, oh, there's some evidence base. For example, we have one master degree student conduct the research on partial cruciate ligament injury for the dog. From his study, he compares with surgery and acupuncture. His finding is acupuncture alone can be successfully treat partial cruciate ligament injury. So now we have evidence to say this paper already published peer review journal. So a lot of surgeons now accept that because clinically we do have a lot of success. And then later on, we also have research, we able to finding acupuncture can mobilize stem cells. When the stem cell release to the system, the body can heal itself, including ligament injury. With university, not only for research, but also able to attract more talented international students come to the Chi University, learn those special modality, more animals able to be saved.
And what is your most popular program?
Our most popular program is acupuncture course. Easy to learn, easy to practice. For example, after students finish the course, they can go home, needle those patients, the patient immediately get a response. One example is like the dog has seizure problems. After the seizure not controlled by pharmaceutical medication, they can simply use acupuncture, add some herbals, the dog able to seizure free. Another example could be there is the dog has a disc problems. After surgery, the dog still cannot walk, still paralyzed. Now we can use electrical acupuncture. Just show on this. Those dogs after stimulate with electrical acupuncture, this dog able to walk again.
Wow, that's amazing. What other integrated veterinary modalities do you offer?
In addition to acupuncture, there are so many other integrated veterinary medical modalities. For instance, veterinary medical manipulation, like this dog, they gain to manipulate, they can help a lot of misalignment problems. We also offer the food therapy. Food therapy can be very good for skin conditions. When the skin is so severe, we can only even food therapy itself to cure the skin conditions. If we have the internal medical illness, like heart failure, liver disease, renal failure, even cancer patient, herbal medicine is a great modality. For those cases, as animal is older, has a surgery case, rehabilitation course is great because that provides the patient able to gain the full recovery after surgery, help older patient give the strength, make the dog have the better quality of life.
Wonderful. The animals look so calm and peaceful in these. Does it hurt?
In general, acupuncture actually is not that bad at all. In general, for people who have needle phobia, for the patient, for the horses, the dog, they just most of them sitting there so calm because they feel they can help them. They have very special instinct. When they help them, they feel much, much calmer. Most of the cases after acupuncture, it can immediately better. Like for this dog, have the disc problem, they cannot walk. After treatment, this dog able to walk again.
Since its launch in 1998, Chi University has helped usher in several generations of animal experts, training more than 9,000 veterinarians from 75 countries. With a combined focus on knowledge, skills, and TCVM, as well as other integrative veterinary medicine modalities, Chi is building a better future for animals, one student at a time.
I find that TCVM is just so important to add to our toolbox. You know, when we're treating disease or treating painful processes, it's something that gets us out of the norm and then also kind of extends our reach to treatment of those diseases and those processes. So I would like to thank the Chi University, and specifically Dr. Shea, for opening his arms to all the students here and, you know, opening our eyes to the world of TCVM. And I'd also like to thank the University of Illinois College of Veterinary Medicine for helping me pursue the certification in acupuncture.
I think what separates Chi University from other universities or organizations that teach traditional Chinese veterinary medicine is it's one of the few places where you can learn all the modalities of Chinese medicine: acupuncture, herbology, tuina, which is medical massage, and food therapy in one place, all taught by highly skilled, highly experienced instructors. Chi University is a community. So we not only teach students the tools of traditional Chinese veterinary medicine, but then we're there to support them. And it's a community of like-minded veterinarians. To me personally, the benefits I've received from my involvement in Chi University, not only did I learn the medicine and learn tools to implement it in my practice, through that community, I now have 2 other veterinary acupuncturists who are very highly trained that are now partners in my practice. So that community has paid direct dividends to me, my patients, and my community.
Chi University's core mission is to provide a transformative educational experience to the school's diverse student body, a task that starts with a team of instructors dedicated to excellence and imparting the critical knowledge necessary to help graduates succeed in their chosen careers. For CVA students, Chi University is not about becoming a veterinarian, but rather expanding educational horizons. Through the school's continuing education programs, students learn alternate methodologies that help support their current practices and provide better care for their patients.
The Chi University stands out from others is because of the founder, Dr. Shea. He has a way of teaching TCVM to Western-minded veterinarians. And then we also have in the lab hands-on experience with 5 students per teacher. What I love about teaching here at the Chi University is passing on the passion of TCVM to other veterinarians.
So my journey in TCVM started because of my pets. They were having difficulties with arthritis, and I just looked for a natural option, one that didn't have any side effects or would harm them. And so it was the best decision I made was to start looking into acupuncture, tuina, and all of the other modalities that TCVM offers. Chi University offers a lot to the students. Consultations on their cases, there's always a lot of support. Even after you complete your courses, there's always somebody there able to help you. As a veterinarian, I'm also an advocate for the wellness of all my patients. So knowing this new alternative medicine has extremely benefited my patients, increasing longevity and their quality of life. I am very passionate about the work I do because I see miracles of healing every day in my practice, and I want every single veterinarian to have the chance to experience that as well.
At Chi University, graduate students like Dr. Mariana Munoz have the opportunity to explore the many benefits of acupuncture, learning a new modality that stands to benefit equine candidates and their careers alike.
When I finished my CVA, I started to work more with acupuncture on my equine patients. What I like about Chi is that you can keep in touch with your teachers. So every time I had a patient, I could just email them and they could help me with those cases. So even now, I still keep in touch with them and I can keep learning even though I already did the course. So I came here to do my master in TCVM. I am international student from Peru actually, and I am really grateful for all the teachers and instructors and to Dr. Shea for giving me this opportunity. I am learning more than what I did with only my CVA. And I think being here is going to help me merge both my Western knowledge and my TCVM knowledge and enhance my patient's treatment.
So I first found out about Chi University through an email from my college's dean where it talked about a scholarship for veterinary students who enrolled in the acupuncture certification program. And I knew it was a sign for me because I had been wanting to learn about acupuncture for quite a while, especially when I was in high school and thinking about going to vet school. My horse was in a demonstration using acupuncture, and I noticed after the treatment the tremendous improvement that it made in his performance. And I just knew that I wanted to do this. And thanks to Chi and their scholarship, I'm already getting a head start in my career. So I think what has impressed me most about this course has been learning about the variety of conditions that acupuncture can treat, as well as the dedication of the Chi staff. Like coming in, I had no idea just how much acupuncture can help with. And I've also been impressed with how dedicated the Chi staff is to my success.
Between its certified veterinary acupuncture program and Master of Science offerings, Chi University is ensuring students have access to multiple paths and the resources, teaching staff, and community they need to reach the next level of veterinary excellence.
And with so much emphasis on hybrid programs, how does the distance learning option come into play?
Long story short, initially I thought impossible to teach students online. But 20 years ago, I watched one of the movie about telemedicine, especially telesurgery. If the surgery able to successfully remotely done, why not teach acupuncture? 2008, we created our ever first online course. The students just love it. I received one email from Australia. Dr. Xie, I love your online program because now I don't need to travel 2 days on airplane from Australia to Florida. I'm still able to watch you, learning from you. That's great. A lot of student feedback to us. Dr. Xie, Chinese medicine is very, very complicated. Your online program allow me able to go back because all those lecture was recorded. They can use their computer play the lecture. So if something confused, they can stop or they can go back learning those material that have some confused. They also encourage you to post any questions they may have online. They're getting the answer from senior instructor very quickly, so give them more confidence to understand about this contents. At this moment, all our courses is hybrid, meaning combination of online and on-site. Students very, very enjoy.
Wow, that's wonderful. And Dr. Xie, what do you think it is that has helped Chi University separate itself from other veterinary-focused continuing education and master's programs that are available?
Well, I believe we have the 3 unique things make us very unique. Number one, we have special hands-on learning, which means every single time we students come to on-site study online training, they get in real cases. We have wonderful local community. They bring their horses, their dog, their pets to us. Our students able to say real cases, directly learn from senior instructor, treat, diagnosis real case. So we have the great mutual benefit with the local community because local community getting free assessment, free treatment, and also their dog, the horse immediately getting better after this session. Our students also learn direct from real case. This is the great mutual benefit for both local community and the university. That's what we always have the real cases come to see us. The second unique for us is special curriculum. Our curriculum is hybrid with online and on-site. Online, basically, we put all those theory principles in online. Students can study multiple times, really understand those principles. Now they come to on-site. This is the intensive hands-on learning, so they already prepare for that, so make the course more efficiency, more effective. Number 3, make our university so unique is we have the wonderful, peaceful environment because we located horse capital of the world, Ocala area. We have a 90-acre horse farm. Typical day, students start to play slow motion, Tai Chi, meditation, make their mind fresh and relax, and then go to the classroom for 4 hours morning learning. After that, we have lunch, 1 hour lunch break, so students can have their favorite food to be delivered to their hand. And then they can walk around in our natural trail, those trails surrounding horses, pasture, and also surrounding this little alligator there, has some bird fly. So they make the mind very peaceful.
And are there any specific success stories, perhaps feedback or stories of your students out in the real world that you can share with us?
Because we're waiting for these questions. We have the thousands of successful stories, but today I like to share 2 of them. One story is from Dr. Colin Spacklin. Dr. Colin Spacklin is equine practitioner. Remember, our first course, 1998, only 13 students. She is one of that graduate.
Okay.
So during that time, she has a very, very severe equine cases. This is 8 years old warm blood mare training for dressage special competition. But that horse suffering from 4 months of the navicular disease. Navicular disease is a special disease in horse. The basic tiny bone under the foot is degenerate. When that degenerate, it's very, very painful. They already use joint injections, pain management. They already use special shows, but this horse still limping. Because of limping, they cannot use for the competition anymore. So option for the client is 2 options. Option 1 is retired from competition, which is not an option for the client. Second option, de-nerve. They cut the nerve. When the nerve is not go there, so the horse not limping. That is very invasive. It's not option. So during that moment, Dr. Colin Spacklin just finished her first acupuncture session. She called up. When they go home next day, she called, Mary, we just learned this new technique. Do you like try for your horse? Mary says, as long as you don't cut the nerve from my horse, not retire from my horse, I will willing to try anything. So to everybody's surprise, after first session, the horse is doing better. It's less limping. After second session of acupuncture, the horse walk is the sound. Sound meaning no limping. After 3 sessions of treatment, this horse perfect. They can jump, they can trot, they can counter. Great. Continue treatment, make the horse back to competition, back to the normal trainings. So 1998, during that time, acupuncture is not well accepted yet. That's what the results speak themselves. Little by little, Dr. Colin Spacklin saw more and more patients. Now she only does equine acupuncture integrated with other like veterinary medical manipulation for her practice. Now she's our good, wonderful instructor, professor in our university. Second story I'd like to share with you is Dr. Terry Rosado. Terry is our medical director, chief veterinarian of Chi Animal Hospital. Last year, she saw the 12 years old Yorkie Terry has a very severe intestinal disorder, is a protein loss enteropathy. So the protein leakage to the gut, the protein cannot be used by the body. So the dog lost the weight, has a bad diarrhea, no appetite, the dog is dying under specialty care. So Interest gave the option to the client, 2 options. Option 1, put her down. Owner is not accept. Or say Dr. Terry Rosado. Terry, she has expertise with internal medicine. When the Terry saw this dog, with combination of acupuncture, herbal, food therapy, and also fecal transplantation. That little dog, wonderful dog, much better after 3 weeks, able to eating better, walking better, diarrhea is better. After 3 months, all those symptoms is gone. 1 year later, this dog still live very good. So that is, you can say, a lot of cases coming to us is last resort. Either retired from competition or put to sleep. Now we have a lot of option help those cases. So in here, I wanted to make a strong statement is every single time when have the cases with the medical approach against the wall, please be considered there are one more options available. Is integrate veterinary medicine may help the dog, may help the horse, save the career or save the life.
Wow, that's wonderful. Dr. Shea, thank you so much for joining us today.
Thank you very much. I really enjoy here today with you.
Oh, wonderful.
Great.
And thank you for watching. I'm Kathy Ireland.